So today we will be studying the remaining images which were left in the ophthalmology section. The first image is of congenital glaucoma. In the congenital glaucoma, the history will be of a baby and there will be edema of the eyes and bluish eyes will be given, increased intraocular tension. So it is a case of congenital glaucoma. Then this is image showing myopia versus hypermetropia. In the normal vision, the image is formed at the retina, and in the myopia, the image is formed in front of the retina. Myopia is due to long eyes. Long eyes, so image is formed in front of retina. The rays are conversed before the retina. While in hypermetropia, the image is formed behind the retina, and hypermetropia is due to small eyes, small axial length of the eyeball. So myopia is long eyes. Myopia is nearsightedness, and hypermetropia is short eyes, and hypermetropia is farsightedness. Then the next image is of the keratoconus, and the classical words which will be used for keratoconus are Munson sign and oil drop or scissoring reflex. Then this image is of keratomalacia. Kerato means cornea and malacia means weakness. Weakness of the corneal tissues. So in this the corneal region will be degraded due to weakness. Then this image is of pterygium. Pterygium is a triangular shape of tissue of the subconjunctival tissue that is encroaching upon the cornea. So in this, the vision may be impaired if it is approaching the cornea and the pupils. Then this image is of stenopic slit. Stenopic slit is used in Fincham test for the differentiation between glaucomatous opacities and cataractous opacities. It is used for determining axis of cylinder, and it is used for selecting site of iridotomy. Iridotomy is done in glaucoma cases, then axis of cylinder in astigmatism, and differentiating the cataractous, that is lens opacities versus the glaucomatous opacities. Then this is the image of bifocal glasses. Here two lenses are used. One is this one and one is this one. These are bifocal glasses and are used for presbyopia. Presbyopia is impairment of the near vision in the old people. So they have to use near glasses. Then this is a image showing applanation tonometry, and the most common tonometer used, gold standard, is Goldman tonometer. This is image of pachymeter. Pachy pen is written over here. It is pachymeter for determining the central corneal thickness. And this is image of ultrasound B scan. Ultrasound B scan is basically ultrasonography of the eye tissues. Then this is showing the intranuclear ophthalmoplegia. Basically what happens in intranuclear ophthalmoplegia. This is baseline. Then this person was seeing towards this side. Here both the eyes can move in this gaze. But when the person sees towards the left, when he is trying to look toward the left, then the left eye is able to move towards the left, but the right eye is not able to move. So the ipsilateral adduction defect will be there. Right sided tract is damaged, so ipsilateral adduction defect will be there, and the contralateral eye, that is the left eye, would be going into nystagmus. So how we will determine the side of the lesion? The adduction defect is ipsilateral and the nystagmus is contralateral. Internuclear ophthalmoplegia is basically due to demyelination disorders like multiple sclerosis. Then this is the image showing the layers of the retina. from outside to inside. The outermost layer is retinal pigment epithelium, then is external limiting membrane, then is outer nuclear, outer plexiform, inner nuclear, inner plexiform, and ganglion layer. Pigment epithelium, external limiting membrane, outer nuclear. After the nucleus, there will be plexus formation, so outer plexiform. Then inner nuclear, inner plexiform, and ganglion cell layer. Then this is OCT scan of central serous retinopathy, showing fluid accumulation under the retina in the central serous retinopathy, above the retinal pigment epithelium and under the external limiting membrane. Fluid accumulates under the retinal pigment epithelium. This fluid is accumulated under the retinal pigment epithelium in the central serous retinopathy. Then this is fundus image with the fluorescent dye showing central serous retinopathy. The classical appearance is smokestack or umbrella shaped. This is looking like umbrella shaped or smokestack, like smoke is emerging from the chimney, or ink blot appearance in the region of the macula. That's why it is known as central. Here is disc and here is macula. Then this image is showing keyhole shaped visual field effect. This is showing the visual field and there is keyhole shaped effect as it can be seen from the image. This is in the form of keyhole shaped. It is seen in lateral geniculate body lesion and it is also known as homonymous quadruple sectoronopia. It is due to involvement of the distal anterior choroidal artery. So basically we need to remember what is keyhole shaped visual field defect due to lateral geniculate body and what is keyhole vision. Keyhole vision is seen in occipital lobe lesions and keyhole defect, only keyhole defect, not visual defect. It is seen in coloboma of the iris. Then this is image showing the multifocal ERG for the central retina or the macular cones. We need not go into details of the ERG. We just need to remember that ERG is for the rods and cones. ERG is of different type and multifocal ERG. It is for the central retinal or macular cones. So that's all about the remaining images. I hope it will be helpful to you to remember it. Thank you.